Picture this. Your lungs, the very organs you rely on for that deep, satisfying breath of fresh air, might be quietly under siege. Even if you've never lit up a cigarette. Sounds like the plot of a mystery thriller, right? But this isn't fiction. It's a reality that often goes unnoticed. Today, we're uncovering the truth about lung cancer in non-smokers and why it's more common than you think. According to recent studies by the CDC and the International Agency for Research on Cancer, lung cancer isn't just a smoker's issue anymore. Non-smokers are increasingly finding themselves in its crosshairs. Now, before you panic or start blaming your city's air, let's take a step back and break down what's really going on. From causes to symptoms, treatments, and survival rates, we'll cover it all with a dash of humor to keep it light. So sit tight as we unravel the mystery behind lung cancers in non-smokers. Lung cancer in non-smokers might sound like a paradox. After all, how can you develop a lung disease typically linked to cigarette smokes if you've never smoked? Yet research shows that cases are on the rise. Unlike the traditional image of a chain-smoking individual, non-smoker lung cancer often hits without warning, influenced by a mix of environmental, genetic, and even occupational factors. So what exactly is lung cancer in non-smokers? And why is it becoming more common? Let's break it down. Let's start with the culprits. First up is radon, a naturally occurring radioactive gas that sneaks into our homes without even knocking on the door. Radon is the uninvited guest that can turn a perfectly cozy living room into a potential hazard zone. Studies have shown that long-term exposure to higher levels of radon increases lung cancer risk, even in those who have never smoked. Next, we have air pollution. Yes, that gray blanket hovering over our cities isn't just an eyesore. It's packed with tiny, harmful particles that can damage lung tissue over time. Think of it as a slow, invisible assault on our lungs every time you step outside. And then there's genetics. Some people inherit a susceptibility to lung cancer, making them more vulnerable regardless of their lifestyle choices. It's like having a secret code in your DNA that occasionally decides to throw a curveball. And let's not forget secondhand smoke. Even if you don't smoke, prolonged exposure to smoke in your environment can contribute to lung damage. So whether it's radon seeping through your basement or the persistent hum of urban pollution, these factors combine to create a perfect storm, even for the non-smokers. So how can you tell if your lungs are sending out an SOS? The symptoms of lung cancer in non-smokers can be subtle at first. A persistent cough that just won't quit. Chest pain that nags like an over-enthusiastic alarm clock. And shortness of breath that makes climbing stairs feel like running a marathon. These are all red flags. Some patients also report unexplained weight loss and recurring respiratory infections. While these symptoms can be caused by many conditions, if you notice them persisting or worsening, it's time to consult a healthcare professional. Early detection is key to fighting back against these stealthy diseases. Now let's talk about fighting back. The good news is that lung cancer in non-smokers is not one-size-fits-all diagnoses, and neither is its treatment. Treatment options are as varied as the factors that cause the disease. For some, surgery might be the best first step, physically removing the tumor to stop its spread. In other cases, a combination of chemotherapy and radiation therapy is employed to target cancer cells with precision. With advances in medical science, targeted therapies have emerged, which work like smart missiles, zeroing in on specific gene mutations in cancer cells. And let's not overlook immunotherapy, a groundbreaking approach that boosts your body's own immune system to fight cancer from within. Each treatment plan is carefully tailored to the individual, taking into account the type, stage, and overall health. It's a bit like assembling the perfect team to win a championship game. Each player has a crucial role to play. Statistics can be daunting, but they also light the way for hope and progress. Recent data indicate that survival rates for lung cancer in non-smokers vary significantly depending on the stage at which the disease is diagnosed. Early detection dramatically improves outcomes, emphasizing the need for regular checkups and awareness of the symptoms we just discussed. Although overall survival rates remain challenging, advancements in personalized treatment plans are gradually tipping the scale in favor of patients. With new therapies and early intervention strategies, many patients are enjoying longer, healthier lives despite the odds. It's a reminder that even in the face of tough challenges, innovation and determination can lead to brighter outcomes. Imagine your lungs as tiny, overworked employees in a busy office. Suddenly, without any warning, they go on strike. It sounds absurd, but it's a reminder that sometimes our bodies throw us curveballs that we never expected. So let's honor the seriousness of the disease while also celebrating the resilience and hope that comes with modern medical advances. In wrapping up, remember that lung cancer in non-smokers is a growing concern, but knowledge is our strongest ally. By staying informed about the causes, recognizing the early symptoms, and understanding the treatment options available, we empower ourselves to take proactive steps for better health. If you or a loved one is experiencing any symptoms, don't hesitate to reach out to a healthcare professional. And if you found this video helpful, give it a like, share it with friends and family, and subscribe for more healthy insights with a twist of humor. Together we can breathe easier knowing we're informed and ready to take on whatever challenges come our way. Thank you for watching and taking the time to learn about lung cancer in non-smokers. Let's continue this conversation in the comments. What surprised you the most? Until next time, take care, keep breathing deep, and remember, every breath is a gift.